So we have some very interesting people to talk tonight. But first, let me introduce myself. My name is Rob Platica, and I'm an online communities manager at EURORDIS, as well as a short presentation about the Porphyria community on Rare Connect. You're going to hear from Rocco Falchetto, who's the president of the Swiss Porphyria Association. You're going to hear from Yasmin Barman, who's part of the Swiss Porphyria Association as well, and who's working to research and to treat EPP. You're going to hear from Victoria in the UK, who, we've all kind of heard some really creative and inspiring moments from her, and, look forward to hearing her ideas tonight. And then Yolanda, also from the Netherlands or Holland, who is living with EPP and has her daughter also living with EPP. So I think we have an interesting climate right now. Before I jump into my slides, we have really unprecedented patient group solidarity, especially after the meeting in Lucerne, where all the patient groups came together and shared their experience, and we're really open to any kind of new ideas. So I think this is a great step that we can continue to move forward from. We have kind of a situation with the regulatory agencies where treatment that many believe in is delayed, and there's a lot of misinformation about that, and there's a lot of things that we can all come together and agree on, and maybe even go forward with from this webinar. There's really a growing international community on Rare Connect. When I went to the Lucerne meeting in May, there was 100 members. Now there's over 200 that continue to just add stories from France or the UK, about everyday life, which is really the most interesting kind of pieces of information we can exchange. And I think through that too, we're seeing stronger advocates for people living with porphyria emerge each day. We have people from the United States living with EPP who just went to the Food and Drug Administration to share their testimony along with the American Porphyria Foundation. We have Yolanda here on the phone from the Netherlands, who's going to speak in a little while, who wrote a letter to the European Medicines Agency. And we have the moderators of Rare Connect and people like Dr. Minder from Switzerland, who have contributed to a growing community and growing solidarity amongst people living with EPP or porphyria across borders. So the goals of the webinar today, what we really want to accomplish, to connect people with EPP beyond the normal communication channels of Facebook groups and text messages and things like that, to share strategies on living with the disease in daily life, and to give everyone the same information at the same time, and discuss future advocacy options. So does anybody else have any other kind of goals or expectations here today?
No, that sounds good, Rob.
Great. So I just have like 5 minutes on the Rare Connect community on porphyria that we kind of have been working on since January of this year. So I'll just get into it. The Porphyria community is supported by EURORDIS, and that's where I work. It's a NGO based in Paris of patient groups from 571 patient organizations in around 52 countries, but specialized in issues across Europe. So Rare Connect, where Porphyria is a community, it's an online social network. The online social network is for patients and families. There are other networks where people can discuss other issues, but this is kind of closed for patient groups, patients, and families. This community is built in partnership with patient groups. They help us to moderate and maintain it. Some of the people speaking here tonight are also the moderators there. And the Porphyria community is in English, French, German, Spanish, and Italian, with human translation across the 5 languages. So it was launched in January of 2013, and it now has 202 registered members from over 30 countries who have added 25 testimonials or stories of living with the disease. And actually how we found Yolanda to come and speak tonight is, she added the letter that she wrote to the European Medicines Agency, and it was just really powerful and really strong, and we wanted to have her message kind of broadcasted even more. There are 77 forum topics on the Porphyria community. It's moderated by patient group representatives and Rare Connect staff, so it's safe information there. Since the beginning, there's been 4,180 unique visitors. On average, every one of those visitors visit 3.82 pages. So that means they're probably reading a story or probably looking over a forum topic. Visitors are coming from these top 10 countries. I won't read them. I'll just let you have a look and find your country there. And if you could add a link to the Porphyria community, that could really help to increase visitors from those areas. If you're a member of the Porphyria community, I just want to remind you of some privacy things. You can go to your profile and make sure under Edit Profile, your privacy is set to members only. Don't include your full name. How about just your first name and maybe the city where you're from, or your nickname or something like that. Don't include your email address or your cell phone number in your post. Make all your posts private unless you want them searchable by Google. If anybody sends you a friend request where you'll receive an email in your inbox to see if they want to be friends, check their profile first before you just accept. And yeah, also just check the members page of the Porphyria community, and if you ever have any questions about the people or the members that are there, please just send me an email. So that's just a reminder on where to check the private box. So why should you join the Porphyria community? Patient data, information, conversations aren't shared or sold. Patient groups, especially the ones here today, are really governing the community. There's the human translation of all stories and forum posts across 5 languages. And you can take place in an international space for supporting patients and their families, kind of contribute to that international knowledge. I'll skip over that. I think most importantly is hopefully after this webinar you can hear these stories. You can consider joining the Porphyria community and see if we can continue to build something together. So there's my email address, robert.platica@eurordis.org. There's the information for the Rare Connect social media accounts, which are pretty good. Yeah, I think after this we're probably going to pull up Yolanda's slides. Yolanda, are you ready?
Yeah, okay.
Okay, great. Let me just pull up your slides really quick. And then kind of the floor is yours. Okay, so Yolanda, on your computer, are you able to click the next button there to go across slides?
Let me see. I can see my first slide, but I can't see. No, I can't see that, but probably you can do that, I think.
Okay, great. So, sorry, if you could just say next slide every time you need the slide change.
I will do that, okay. Okay, this is my PowerPoint presentation. I've tried to capture everything in short words and also in pictures, because I believe that's a powerful thing we can talk about EPP and what it meant for myself, for my family, for my childhood, but also when I'm grown up and even as a mother, which I'm right now of a 4-year-old daughter. And also I'm telling about the test I've done with the new medicine, the clinical trial. Okay, I was born on a very sunny day on 26th of July, and I was 11 years old when they finally knew I had EPP. And that means that in the first 11 years of my life, and I go into the next slide, this is how I see my life. I see my life especially in the darkness, especially in the summer. And the lightness is when I have taken the new medicine of clinical, because that is a really totally different kinds of life, of quality of my life. When I'm going to the next slide, you'll see what kind of characterizing of my childhood I have been giving you. First of all, the darkness, this was the first slide already, but also the misunderstanding what you have when no one knows what you have, but you are really in pain. Pain also, the fear. Also that you know you are different, but you don't know in which way you are different. The loneliness, because family excluded, I'd call that. When you are very young and you're sitting on school, you can't play outside with your friends. You can't go outside in the summer with your friends. You can't go outside with your family. So the loneliness, the alone, the guilt also, the hurt. I had a lot of guilt to my father and mother and my brother and sister because they can't do what they wanted to do because I couldn't go outside. And also the question about why. Why do I have this? That's what my childhood was like. And the same story I also read with Patricia, to send to special homes because they think that I didn't have anything, that they held me into the sun with 4 people, day in, day out, for more than a month. You couldn't see anything else but only my bones at the end of a month. Those kind of things we all have experienced, and that is also the fear, the pain, and everything everyone feels when it's got EPP. But also, I believe what my parents have felt, the misunderstanding, that you couldn't take care of your own child because they didn't knew what I was having. So that's what my childhood looked like. When I got to my puberty, this is the next slide, and the maturity, there were a lot of questions popping up to my mind because I'm at 11 years old, I knew I had EPP, then I also knew that I couldn't do a lot of things. I wanted to become something on a special school that it needs that I have to go outside, but I couldn't do that. So my study was totally different from something I really want. With your relationships, you've got problems, friendships, work, vacation, and even when you became older, and you get, and I get a partner, the wish of a child. How are you coping with those kind of questions? But most of all, and that for me was very important, that I didn't want to be different, but I was different. And not only because I couldn't go outside, but if I could go outside, I had special clothes, and also Patricia even said it, so, your gloves, your everything. I always tell myself almost like a burqa. I was dressed up. And I didn't want that. So that's something I had to deal with it all my life, I believe. And then I became a mother. That's another part of my life. That's the next slide. And at that moment, you have a lot of discussions. I'm not the mother of my child because I'm married with a woman. She has carried the child. That's also a very important choice for us because I didn't want to have the child with EPP. But when I had a child, at that moment, the guilt, what I experienced in my childhood, is coming back because every summer, every day, the sun is shining and she wants to go outside. I have to disappoint her because I can't. And then the hurt is just coming back. What I feel when I was a child for myself, I feel the hurt because I can't go outside, so the grandmother, the grandfather, my partner, my wife, everyone is taking her out to the beach to do a lot of great stuff, and I'm very happy for that. And then I'm lucky that I have a lot of people who are doing that, but I also only hear the stories. I can't go out with them. I don't feel it. And that's the hurt, what you feel inside then. And also that your wife, my partner, has to do almost everything with our daughter, and I can't do anything. That's also feeling a part that you never are, that you're a little bit failing. I know I'm not failing, but sometimes it feels like that. But for special, I'm very grateful I have a daughter. Be aware of that. So maybe the next slide then. Yes, and then there was, and I've tried to explain what I feel when I get that medicine. The medicine of Clinical, who called Chinese. For me, it's a miracle because I have never expected in my whole life that there will be a medicine for EPP, and suddenly there was. And what you then experience when you can go outside without thinking about anything to wear, or just to feel sitting outside as a normal people, as a normal person, but also to go outside for the first time in my life with my daughter. I'm going to the beach, go to the sea, and also with my partner. We went for the first time on holiday together, the three of them, to the sun, what I'm saying. And I've tried to capture those pictures on the next slide for you. Are some pictures what I've done in 6 months. I've been to Greece, to Rhodos, with my daughter and with my wife. I went to the sea. I went swimming. I built castles into the beach. We were sitting on the terrace, drinking just some. This time I see it's alcohol. I'm sorry. We were swimming. We went outside bicycling, everything like that, and. For the first time, this is for me freedom.
Hey, Yolanda, can I just interrupt you here and make one comment?
Yeah.
Those are really beautiful pictures.
Thank you.
Yeah, and I'm glad you could share those here today. It seemed like one great vacation.
What you said? Sorry, I didn't hear the last thing.
It seemed like one great vacation.
For me, it was a 6-month vacation. I'll show you some picture of Rhodos, but believe me, at home, I didn't have to close my windows anymore. I just could go outside without thinking what I had to do. I just could go outside, sitting in my garden with my daughter or with my family. Also, the little things that normally we always have to think about everything, it was done. So this is really, Rhodos is nice, it's very fantastic, great, but this is not for me why it's so important that we get that medicine, because I believe, and that's the next slide, it's about freedom, it's about quality of life, it's about happiness, it's about to be a part of the society, it's about gratitude, love, joy, it's about to be normal. That is what I'm feeling, and I have experienced that for 6 months. And that is what I hope that everyone could experience is with the medicine who's got EPP. And if you see the next slide, this is a difference between having the medicine or having not the medicine.
Thank you so much, Yolanda, and I hope that at the end people can ask some questions and benefit from your experience. I wonder if maybe now we can ask Rocco to give us a quick update about where we are with this treatment at the European Medicines Agency, especially, and there's a lot of maybe different information floating around there on Facebook groups and email groups, but maybe now we can kind of just say a few facts, the few that there are, as frustrating as they are. Rocco, maybe you can talk a bit about that.
Sure, Rob. Thank you, Rob. And thank you, Yolanda. This is really a very difficult presentation to follow, because you said essentially everything that was necessary to say about how it is to live with EPP. And the pictures were fantastic, which are normal pictures. Rob said it. It's about living a normal life. That's all that we want with EPP. And you pointed out that CNS is bringing us some hope. So, and it is something that we heard a lot about in the last few years, and especially in Lucerne this year in May, at the conference on porphyrins and porphyrias. We heard a lot of that. We heard a lot from scientists, some exciting data about CNS, and a lot of patients reporting on that, particularly also Swiss and Italian patients who have the privilege to have CNS, to be able to be treated by CNS even beyond the clinical trials, but I'm going to talk about that a little later on. So one of the things next to Rare Connect and webinar today, there were many good things that happened after Lucerne. But one of the most important things for me was that we as patient organizations got together and expressed those concerns that Yolanda talked about, and we felt we needed to do something to raise awareness how important it is that we give our testimony to the regulatory authorities. Because one of the fears that we had was that the severity of EPP is not recognized as it should. Also, we don't know, but just to be sure, our concern was that the regulatory agencies, particularly the European Medicines Agency, the EMEA, which is currently reviewing the request for market authorization for CNS in Europe, we thought it could be useful for patients to give their testimonies on EPP and maybe also on their experience with CNS. And so we decided to get together, write a letter to the EMEA, and we work closely with EURORDIS, the organization which Rare Connect and Rob are part of. They have a seat at the EMEA, and they have experience at how to interact with the EMEA. So with their assistance, I wrote a letter which I shared with all the other 13 or 14 patient organizations that were at Lucerne, got feedback, input, and in the end, we sent a letter to the CHMP. The CHMP is the Committee for Human Medicinal Products, which is reviewing the dossier for the CNS authorization. I wrote that to the chairman of this particular organization, of this committee, and they actually replied. They replied a very positive reply in my view. And you can see the letter right here. It says it's true. The EMEA replied. 1 week, 2 weeks passed, and I started thinking that I was going to reply. But they did reply in a very good way. They said absolutely. They have mechanisms in place to listen to patients, and they resort to those mechanisms when they feel it is necessary. And they were very happy to receive letters, like the letter from Yolanda. They didn't specify your letters, in particular Yolanda, but they said many other patients had sent letters, and they appreciated us as community of patients sending them a letter. And so now they have a good channel with us European patients through this letter, through me and the other patient organizations. And at this point, they are not requesting to see us. I cannot say that it is a bad thing, because they're looking at it, and they will decide whether they want to talk to us or not. Maybe it is not necessary. Maybe they understand enough by the letter that we wrote, where I expressed our concerns. But at the moment, they're certainly considering it, and we'll have to wait, because there has been a delay in the approval of the drug on until the beginning of next year. I don't know why it is delayed here. Maybe it's to give them more time to consult, maybe consult also with patients, and also to get additional scientific information because they will use extra data which will come out of the American, the US trials. And all of that together, for me, was very positive. I understood and I felt the EMEA knows that EPP is a serious, severe disease. But they also have to work with scientific data, and here I cannot say if they find things in the scientific data that they still need to be convinced of. I hope that the scientific data will convince them. If they need additional help, I hope they will contact them, and I will try to reconnect channels to everybody up. Do you want to add anything, Rob, to this?
No, I think you said it all, really, Rocco, and yeah, thanks so much. And just to say that Rocco's a guy who's very kind and always very approachable.
I'm sorry, the line is very disturbed.
Yeah, a lot of noise.
Yeah, a lot of noise now?
No, that's good. And maybe if you don't have anything else to add, Rob, I would like to add one thing.
Yes?
As most of you know, FEMES is not approved yet, neither in Europe nor in America, but Italy and Switzerland, they have a temporary approval until formal approval will be given by the health authorities. Now, this is a special law, very similar laws in Switzerland and in Italy, which I encourage everyone here in the UK, in the Netherlands, in other countries, through your patient organizations and especially through your Porphyria centers, to talk to your doctors and ask them to check their national legislations, because almost every nation has similar laws that will allow provisional access to drugs which are in an experimental phase. We managed to do it in Italy and Switzerland. I am sure with the right engagement from the doctors and Porphyria centers in the other countries, you might be able to do it in other countries as well, even before the authorities approve it formally. So I really encourage you to do that. Thank you.
Thank you very much, Rocco.
Yeah, thanks, Rocco. Okay, so we heard from Yolanda and we heard from Rocco so far. Miriam or Victoria, who would like to talk next?
I don't mind.
Okay, sounds good. Let me just pull up those slides right here. Okay, sorry, I'm at the last page.
Okay.
There we go. Victoria, can you see the next page and the down arrow to go?
Yes, I can do that.
Okay, great. Here's Victoria Harold talking about life with EPP in the UK. Thanks.
Okay. Yep, I'm Victoria from England, Mansfield to be more specific. And this is a short presentation, my first ever PowerPoint presentation on my life with EPP, and now I can't see my presentation. Oh, that's it. Okay, so that was a photo of me that was taken about 4 or 5 years ago. My first time of raising awareness in local media. That was taken from our local newspaper. I was diagnosed when I was 24. And it was a hard journey, a really hard journey until then, of wondering what was wrong with me and trying to get people to understand how I was feeling, and the fact that I was in pain, because people couldn't see that I was in pain most of the time. They didn't believe me. They thought that I was insane. They put me on antidepressants and things like that. So it was a hard journey, but there was a light at the end of the tunnel. So I'm answering some questions here that were given to me. So what sort of impact did EPP have on my childhood? Well, as I said, my childhood was a lonely one with EPP. I suffered alone and I dealt with it alone. As I said, I was accused of attention seeking and was even given antidepressants. No one actually believed me, even when I used to end up in hospital with swelling and blistering. I remember a time when my nose was black and actually my lips swelling that much that they touched the end of my nose and it pushed my nose up like that. And my hands and arms and feet were swelling. I even ended up in a wheelchair as I couldn't walk, and yet I was still accused of self-harming. A doctor told me over the phone that I was so toxic, and that was that. He didn't want to see me, he didn't want to talk anymore about it. But I knew in my heart that there was more to that story. So I tried every new doctor that I could find, until one day a doctor actually took an interest in what I was describing, and I was sent to dermatology, where the doctor, although never came across someone with EPP before, had heard of the symptoms and ran the test. A month later, I was diagnosed with EPP. And how did I feel when I found out about this condition? Well, when I was finally diagnosed, I felt a sense of relief, as finally I really wasn't making this up or self-harming, this was real. I actually thought for a period of time that every single person suffered the way that we did, because nobody believed me. I also felt anxious and wondered what would be next and how I would adapt now that other people knew about my disease. It was almost like having permission to be this way. And does EPP affect the clothes that I wear? Well, I am a bit vain, I will say that. And I do struggle with outfits. I don't have frilly summer tops, and if I have frilly summer tops, the cardigans come out. And I don't have any flip-flops or open-toe sandals. Sometimes people don't understand why I don't want to buy the open-toe sandals. And sometimes I get sick of describing why I can't have those open-toe sandals. And my summer outfits consist of long skirts, which I'm wearing today, long sleeve tops, socks, shoes, gloves, hats, and even a UV sun umbrella. And that photo there was on a trip to Alton Towers, and that's my UV sun umbrella. It's in the shape of a love heart. I can't have anything normal, you see, it has to look a bit different. And how does this make me feel, having this condition? I mean, I'm getting used to it, but I still feel odd and very aware of people's glares and comments. Yes, I know I could ignore them, but those people need to try listening to those comments themselves and see how they feel. And the psychological and physiological implications of EPP. Well, EPP is a very restricting disease. I'm sure people here who have got it know how restricting it is. And it tries to control when you can go out and which side of the road you should walk on. When I'm out, I'm constantly thinking about what I'm doing, how long I'm going to be, and aware of the harm the sun could do to me in any given second. And this is a hard one. How do you describe EPP to people? How do you approach the topic with people that you don't know? Well, I wouldn't be the only one that's struggling with this. And I explained that I am actually allergic to the sunlight. And you get questions like, oh, well, you get tingling, you burn and things like that. And it's like, no, I'm actually allergic to the sun. Like somebody who is allergic to peanuts, I am allergic to the sun. It's not like hives and it's not prickly heat. This is more than that. And that it causes great pain and swelling that I would not wish on anybody. and I can lose the use of my hands, and that is a big fear because not being able to use the scissors, not being able to use a knife and fork, not being able to pick things up, not even being able to have a shower because the pain is so much. And have I met anyone else with EPP? Well, yes I have, and I've actually met Javelin a few years ago at a Porphyria conference in Wales. And I've met other people. I actually met somebody through a group that was on Facebook, which I now co-run with 3 other people. And we have over 300 members on there. And it's so good to have that support at last. It's so good to be able to give that support to so many other people who suffer the way that we do. And we don't sympathise with each other because we feel that we should. We sympathise with each other because we know what we're going through. Each and every person that is connected with that group, and we know pain. And that's my presentation.
Thank you so much, Victoria. That was very nice kind of talk about what's going on. What would you say are the most common questions in that Facebook group that you run? What kind of issues are people coming up with over and over again?
Well, we have a new thing at the moment where the government are getting rid of normal light bulbs. Yeah, I think it's your incandescent light bulbs, and we're now having problems with fluorescent lighting and LED lighting, and that is becoming even more common. So that is quite a known subject at the moment.
And so what kind of lighting works best for you?
The incandescent ones. I actually have a bag full, and I take them with me wherever I move to.
Ah, nice. Okay.
And it's about educating other people.
Okay. Hey, thanks so much, Victoria. I think maybe next we were going to have Miriam. Miriam, what do you think? Are you ready?
I am.
Okay, great. Yeah, it's really nice to have you here tonight, Miriam. Miriam was another person that we met through Rare Connect, and we just thought had a very interesting story to tell. So yeah, the floor is yours, Miriam. Take your time.
Hi. I live in South Florida, which is very, very interesting. We used to have trouble with sunlight. It's on and off. It's constant. We get sunshine during Christmas. One of those. So you learn that sunshine comes from everywhere. I'm really glad now that I did photography for a while because I came to realize how I'm just on top of everything. And I have lots of customers. I'm like one of those girly girls. I have those, pretty little glass baubles everywhere. Everything works directly on you if you're not careful. It gives a little sliver of light, and I'm always standing in it. So I learned very, very quickly that there was something wrong. I was also undiagnosed with dealer skin loss growing up. So I was pretty free when I found out exactly what was going on. It took a very, very long time, a lot of doctors, a lot of guesswork, and I turned about 28 and I decided that I really needed to be healthy. At that point, I had COPD, migraines, seizures, hypoglycemia, constant pulmonary infection, heart palpitations, and rashes, and my doctors are always, oh, well, we can make you comfortable. Here's some medication. Let's try this. Painkillers. And I'm not one of those girls. I can't pop pills all day. And I came off of most painkillers when I was 17. And I said, this is going to be my life. It's going to be how things are. And so I hit my late 20s. I have a younger brother and a younger sister. I'm 12 years older than one and 11 older than the other. And those were getting increasingly more and out my brother and sister both also have Ehlers-Danlos. And it got to the point where I was like, okay, I'm going to go to every doctor I can. I'm going to be the family guinea pig, and we're going to find out what's wrong. And I decided the only way that was going to happen was to get rid of everything I could get rid of and control on my own. So the first thing I attacked was a migraine. That didn't work very well. Intractable. Couldn't figure out why. So then we started working on COPD. My lungs have been a disaster since I was 5. Ehlers-Danlos gave that to me as a really great gift early on. And I decided to do nutritional route. Every kind of vitamin, super healthy food. I mean, I've always been a health nut, but I decided that I was going to overload my system with vitamins, natural, not so, just eating tons and tons of vegetables, see what would happen. My lungs finally came under control for the first time in my life, 25 years, after being told there was no hope for them. And the great thing about that was we realized that even with my lungs under control, I was still having swelling, I was still having allergies, and I still had a myriad of other symptoms. But as we had one problem solved, we were able to actually discover that I had Ehlers-Danlos. Once we got that taken care of, I was on great medication, features much better, things were improving, and I was living in Kentucky. I got a really bad sunburn, much worse than my usual. I go out in the sun and I get rashes and things like that. And it started to snowball. One of the things that happens when you have EPS is your body doesn't control things like heat and cold very well. I could be standing at 105 degrees like I was the day that I got that burn, and I was cold. My teeth were chattering. So I kept standing in it. And about 11 sunburns later that summer, they realized what was going on with my skin. And so now I'm finally diagnosed. I spent a lot of less time in the sunlight. I don't even try it anymore. My husband and I both work overnight, so that works out well for us. We have most of my life overnight. But what I did learn from the experience of not knowing what was going on is that you can do. And what I could do was help other people. I learned to work with kids, mostly kids who have much worse issues than I did. I work with abused children and women. I learned how to help my brother and sister. Just learn that you can just do anything you want, no matter what. My brother is actually pre-Olympics right now, and with Ehlers-Danlos, you're very squishy. You know, you're loosey-goosey, things fall apart, and he doesn't care. It's amazing. He runs around, jumps off the buildings for fun. He's incredible.
So,
and I'm sure all of you have gone through that. You know, being sick, ever since you're a child, you learn all forms of perseverance. I think that really pushed me. It kept me from getting depressed about it. It kept me from being upset that I had my brother and sister who looked up to me, needed somebody to say, okay, you can take this and you can learn to live with it.
And so Miriam, you're waiting right now for some testing in terms of trying to pinpoint what else besides Ehlers-Danlos might be causing some issues.
We are waiting on the final test. Everyone's fairly certain it is absolutely PCP. The reactions that I have with my skin, the impermeable swelling, even with regular life for early adopters of skin cells, and I used to burn terribly from having those lights come out.
And when did that start for you, Miriam?
I had trouble with this one ever since I was little. I started out mostly with the rashes, the stomach aches. I always had stomach problems. And it just got progressively worse as I got older.
Oh, wow, very nice. Thanks for sharing that experience, Miriam, and I hope everyone's still ready for questions and saving their questions for the end of the webinar for all of our presenters here today. I think we're going to go over to Yasmin. Yasmin, does that sound okay?
Yep, that's fine.
Okay, great. So I will just pull up your presentation here. Oops.
Is there still noise for everybody? Because I have a lot of noise.
I'm doing fine, actually.
Yeah,
It's fine.
I know it's better. Fine.
Okay, here I've just skipped the... Okay.
So first I want to introduce myself also a little bit, but then I have a special topic I want to focus on. So I can't see fine. So I'm also a patient of EPP, with the first symptoms coming in the age of 2.5 years, but I got my diagnosis in the age of 28 by internet research. So I found a small article at Wikipedia, which was written by another sufferer in Germany, and not by the physicians. I studied biology then, so in my last year. I'm finished now, and at the moment I'm a researcher at the Institute of Laboratory Medicine in Switzerland, which is the Porphyria Reference Center in Switzerland, in Zurich, with Professor Minder. And there I'm a PhD student, and my subject is the investigation of the iron metabolism in EPP, but I'm interested in all kinds of things which concern EPP. I'm also a member of the Swiss Society for Porphyria and the German EPP group, and my aim is to raise public awareness and to empower the patients, because we know that the media attention is very crucial to increase the number of early diagnoses, and also what makes it what I think is really important is that the people and the patients know their disease, because if they understand, they can make it understandable for others, and they can also better deal with it. So, but today can you go to the next slide?
Yeah, no problem.
It's not working.
Oh, okay.
Yeah.
This one,
So,
okay.
today I have a special topic. This is the difference between light and UV radiation. And why is this distinction so important in EPP? So everybody knows that in EPP the main thing is the light sensitivity, and that the short sunlight exposure nearly immediately leads to an itching and burning and pain and unpleasant sensations on all skin areas which were not covered by clothes or shadow. And this is mostly without visible changes of the skin, and only longer exposure times result in reddening and swelling, and those are also accompanied by severe to endurable pain and also with visible changes. So as you can see in the picture, this is a German EPP patient, and she had a company day out without the possibility to protect herself from the sunlight. And if you have a closer look, there is also the areas where she wore rings. They were covered and therefore protected from light, and there she has no reddening and burnings. And also what was mentioned earlier, that even artificial light can trigger the symptoms. So on the next slide, I therefore have a sketch about sunlight, which is the radiation and rays of the sun. And this is composed of a lot of different kinds of radiation. So we have the radioactive and the X-ray, the UV radiation, the visible light, the infrared and the radio radiation. And so the difference between all those different
light or the radiation which comes from the sun is visible to the human eye. So the colors, basically. And why it's so important is that on the next slide, I made a sketch about that only the visible light is the problem for EPP. So the symptoms are caused by mainly the blue light, but also to a lesser extent the green, yellow, and red light. And this comes because this protoporphyrin, this is the molecule which accumulates in EPP. This is the precursor of the red blood color. And this reacts with the visible light range and with the energy of those colors. So on the next slide, I also have sketched about the difference between the EPP symptoms and normal sunburns. So if normally people, they get a sunburn, this is because of the UV radiation. And this UV radiation, it triggers the tanning of the skin. But if you have too much, then it causes sunburns, which also can lead to skin cancer. And in contrast, the visible light is normally it's not a problem for normal people. It does not cause health problems. Only in EPP, there it triggers the symptoms. But the good part is that it does not lead to skin cancer, as we know. But for us, the visible light range is the important one. The next slide, there is one thing you should not be confused on, because if people usually, if they think about this UV, they might think of these tanning beds, and they always emit also some blue light, and therefore most people think that blue light and UV radiation is the same thing. But the background is that the bulbs which are used for this tanning bed, they are not sharp. They are not sharply emitting those UV radiation, but also have a small portion of visible blue light. But you really have to distinguish those two kinds of radiation. The next slide. There is the consequence of this, because sun protection in EPP means that you have to protect yourself against the visible light range. And this is best be done by clothes, as most of you know, thick, dark, and densely woven clothes, hats, gloves, scarves, things like that, or shadow, or the absence of light. So this can be done by umbrellas, as you can see here, myself in the Swiss mountains, and also the shadowy side on the bus or the streets. This is what works for us, and hopefully in future we will have Senet, which is tanning of the skin without sun exposure. I come to that later on. The next slide, I mentioned the UV protection, which is something else, and the thing in EPP is that we also have adverse experiences with UV protection. So one could say, okay, if I protect against UV, it doesn't harm, but this is not true. So especially sunscreens, they're called sunscreens, but they only protect against the UV range. And to my knowledge, most adult patients I know, they report adverse effects with sunscreen. And they do not use it any longer. Some of them had to use it as a child. Was also myself. I tried to use it. I never found one which worked for me, and I also know this adverse effects. And the main consequence is that parents with children which are affected by EPP, they should not force them to use it. I mean, if they request it and they want to try, why not? But you should not force them. The same is true for UV protection clothes. They are mainly costly and ineffective because UV is not the problem. And one has to be really careful because some of the UV protection clothes, but also white clothes, they have a chemical which works by converting the UV radiation into visible light, and mainly blue light. So it even adds to the symptoms, adds radiation which causes symptoms. And another thing I want to stress is the social pressure which is associated with ineffective light protection measures. So especially when children are involved, this is really a big problem because all those costly measures like sunscreen and special clothes and things like that, some parents, they then think, okay, they spend all the money and now the kids should work or should function in a way, and it's not possible because it doesn't work. So be aware of those effects as well. Okay. We have beta-carotene mentioned before. Just one word to this. It was thought that it also adds some tanning to the skin and should protect, but there is a lot of reports now which say that it doesn't work. I mean, it doesn't harm, but it also for me it doesn't work, and I don't know anybody which reports. Now back to beta-carotene now. So this actual slide here is the intersection of the skin, and I have the invisible UV light radiation which comes from the sun, and if it hits the skin, it causes some damage to the DNA mainly, and to other parts of the skin, and this damage triggers a hormone production, which leads then to tanning of the skin, which is on the next slide. And so you get darker or browner, and as a consequence, the UV radiation is reflected. It's not penetrating the skin any longer and does not cause harm. Which comes if you click on it. Can you hear me well?
Yeah, click. Oh, there we go.
Yeah. Great, okay. But the question is now what happens with the visible light. On the next click. And also the visible light is reflected. So this is why or how a darker skin is more protective against the visible light and also the EPP symptoms. But as we EPP patients can't go out easily and get tanning, this is the idea of finesse, that we have artificial hormone, which is on the next click, you can see, which is an implant which contains this hormone, which is implanted under the skin and releases it and induces this tanning without having to be on the sun before. So then I summarize shortly. So in EPP, it's really crucial that the visible light causes the symptoms, and therefore UV protection measures like sunscreen and UV protection clothes are useless in EPP, and sometimes they can even cause adverse effects. Finesse works for EPP because it blocks the visible light to penetrate the skin, and the best protection so far is thick and dark clothes and umbrellas and things like that. We hope for finesse, and I hope everybody can go out like this in future without having to think too much about visible light or not visible light, and so hope for the best, and thank you for your attention.
Thank you so much, Yasmin. That's a nice double rainbow photo you got going on there.
Wikipedia.
Yeah, okay. So I wonder, here we are at 9 o'clock Central European time, but I wonder if we have a few minutes for questions. I'm sure people kind of have some questions about what was presented. And if people want to connect their microphones, they can do that. And to ask a question verbally, they can also ask them just in the chat box, and I'll kind of try to repeat them. Let's see, where can we start here? See, there's already some conversations going on. What is the chance that our son has EPP? He is 11 months. Well, we need more background information on that one from Tierney. Tierney, if you have a Porphyria patient group in your country, you should try to contact them. The daughter is 3.
You already have a daughter and who also has EPP. He's 3 years old, but you can't say if son also will have it.
Yeah.
When can you do a test for EPP?
I believe also at 11 months you can do the test because it's just a blood test, I believe.
So what is the test for EPP? Blood test?
It's all 3. They test your blood, they test your urine, and
They test your number 2.
Okay.
Your stool. They have to wrap it all in foil so that it doesn't react with the sunlight in order for the test to work properly.
I had all 3 done.
Yes, I did. Very pleasant experience.
The really conclusive one, though, at the end of all these tests, one should always do a genetic test that will confirm the disease.
Yeah, I didn't have that test.
Especially if you have a family, you want to know whether your child has or will have the disease. A genetic test should be done. But usually the easiest test is the levels of protoporphyrin in the blood.
Yes.
If that is high, that's already a strong indication of EPP.
I did have a genetic test, but when I was 40 years old, because then we thought about the daughter, but not sooner. You're correct. When you want to, if you try to have a child, then it's better to do a genetic test because they can tell you how many percentages you will have.
test your number.
Get a child with EPP.
And there were some questions, recently there was one question about a parent just discovering their child having EPP. The one thing that I would suggest to every parent who has a new diagnosis for their child, is to find the nearest Porphyria center, the nearest to them, and if there is no Porphyria center close to them, to at least find a physician who will consult with the Porphyria center, because EPP and all Porphyrias are very complex diseases, and the regular physician with no background in the Porphyrias will not have the necessary expertise to know the necessary measures to be taken for the children. So convince your physician to connect to their closest Porphyria center. That's the most important thing. All the rest, talk to us patients. We can share our experience, and most of all, try to behave in such a way that you accommodate your child's needs.
And if you're having trouble convincing your physician to contact a Porphyria specialist, what would your advice be?
I would, well, the second step certainly to contact a patient organization, and through them try to convince the physician. Other than that, change physician.
Okay.
Find somebody who has a more empathic approach. Really, this is very, very important. It's important for EPP, even more important for acute porphyrias that can be quickly very life-threatening. or EPP as well, usually doesn't have any serious medical consequence if you don't do the wrong thing. But you should always get your liver parameters checked because of the potential danger of liver complications, and you simply want a physician that can give you a reasonable advice as to what it means to have the disease. Like Jasmine just showed you scientifically what it means, the difference between UV and light. These things, it's something that many people don't know and try out things to protect against UV. They're not effective in EPP usually. Even physicians prescribe that. Physicians prescribe beta-carotene, even if there is no clinical proof that it is effective. It may be effective in some patients, but there is no clinical proof. There are no studies that have been carried out on it. The only treatment where clinical studies and scientific studies have been performed in an objective way is MS currently. Other than that, there is no other therapy that has been scientifically proven efficacious for EPP. So even physicians make mistakes believing in those things.
Thanks very
I
much.
can ask a question to Rocco.
Yeah.
Rocco, we are trying, we have asked patients of EPP to send us letters. I've got now 32 letters from EPP patients, and we're going to send them to the email. But we also are trying to get stories of the parents who have a child with EPP, or friends who have friends with EPP, or colleagues who have colleagues with EPP, and things like that. We are doing that on the net with Facebook. Do you think that also could work, that we have to send that to the email as well? Because it not only affects us as a patient, but it affects also our families.
I think this is a very good idea. This is actually something that the American Porphyria Foundation, they have done the same thing. They collected letters, and they collected letters from patients and family and friends, which is very, very effective, especially if you have small children with EPP and you can tell your life as a parent with a child with EPP. I think it's absolutely a very powerful testimony. And, I'm doing the same thing, collecting letters from patients. I'm not going to send them right now to the EMEA because I'm waiting essentially for their instructions as to how they want those testimonies. But I think it is certainly useful to start collecting this information. Should we be contacted, and should the EMEA want to hear about us, or want to hear in person, in writing, on whatever other way, we should be prepared. So it's a very good idea. And asking parents and friends, excellent idea.
Okay.
I would also suggest looking for tertiary care where the doctors are already. A lot of the trouble that we have getting diagnosed, going to a few doctors who aren't working together, and we have a tendency to want to figure it out themselves, and we're not as likely to go to someone else for help, whereas the doctors already in a tertiary care center, you're more likely to consult each other, you're more likely to figure out what's going on a lot faster. At least that was true for me. I went to a lot of individual doctors. Once I went to a tertiary care, everything was resolved very quickly.
I had a case of that during my last loss of light treatment. Nurses thinking that they know everything about EPP, and they had no idea, but they didn't even research the information themselves. They asked me how my rash was doing and if it was getting better. This is 3 months into the treatment.
Wow.
So, I know what you mean.
Oh.
For those in the UK who have EPP, I know that there is a specialist in South Wales, and I believe that there is one in Manchester who can help. I'm not sure of any others.
And also, if anybody needs help, get on Rare Connect, because if you write something on Rare Connect, you have moderators like myself, Yasmin, and others who can try to help answering some of these questions. If you're looking for a specialist, we'll try to help you find a specialist nearest to you, at least somebody to get connected who may know a specialist. This is, I stress it again, it's very important. Once you get the diagnosis, make sure you connect to an EPP or a Porphyria specialist.
Thank you very much, Rocco. That's a good point. Where if somebody's ever posting a question, the first thing we do is try to find that national patient group who has the knowledge about the doctors or other individuals who have been through the same situation. Let's try to continue to build that international knowledge and movement where everybody can get the best information as possible.
There was a question that was asked earlier of, as you get older, does EPP get easier?
No.
Rocco.
I guess the older one here.
You're not so old.
Since 2006, it dramatically changed because I take Senets. I have the fortune to be treated by Senet since 2006, so I almost forgot I have EPP. I'm almost not qualified anymore to talk about EPP, but trying to remember until that time, it was very hard, regardless of the age. What gets better is, of course, your experience, and you are better able to cope because you know how to cope with it. You develop strategies and all that, and you finally come to accept, at least in my case, I came to accept my condition and lived in the constraints it imposes on you. But I wouldn't say that the symptoms were getting better. No.
I find that I suffer more now, more than a child. Maybe it's because I'm more aware of it. Even today, sitting in somebody's car, with my sleeves over my hands, I could still feel it, and I hadn't even been out that much today. I guess it depends on your levels as well.
Yes, we don't have to forget that diseases, regardless which disease, are very individual. EPP, I know hundreds of patients now, and even though they all tell the same story at one level or another, the degree of sensitivity varies a lot, I would say even dramatically, from one patient to the other. I know patients who have EPP but have almost no problem staying in the sun and have one event once a year, and it's a light event. And I know patients that they can't stand even a single ray of sunshine. So it's a large variation among the patient population.
And the thing which I think becomes better is that you are not this dependent as an adult as a child. So a child is in the school, and then there is this trip to the forest or somewhere, and it has to go out with them. As an adult, you can say no, the weather condition is not good for me, I refuse to go. This is the thing which I think changed most.
I'm part of a very active church, and in the summer they go on days out, and just recently they went on a day out, and I couldn't go, and you actually feel really left out, and you can feel quite alone. It really does comfort them.
A couple of churches that are pretty active, and I go depending on where the sun is that day, which church I'm going to go to. I walk away, the light comes in the window.
Yes, I'm like that too. Are we getting some more questions through?
Yeah, are there any more questions right now?
Is it also possible to get Senetse in Switzerland or in Italy also for patients from Holland?
It's may be possible, but it's quite complex. I cannot give you really a good answer today. I told you on Reconnect I would try to find out. I mean, the first thing really I would advise you to try in Holland. Holland, for me, is always striking, such a progressive country, and I couldn't imagine that they don't have a law similar to what we have in Italy and Switzerland. I would really encourage you to, together with your own of the Dutch Association, try to find out what's the legislation in Holland. I'm not saying it's not possible in Switzerland for foreigners to get the drug, but I can imagine it can be fairly complicated, if even possible.
So, Yolanda, this is Rob from EURORDIS, and my perspective is, to add to what Rocco said, is that you need to look around for compassionate use programs. I'm not sure how that quite will translate into Dutch, but compassionate use programs is where the company, Clunevel, would work with the Dutch health authorities to provide access to medication because it could really change someone's life before that medication is fully regulated and has marketing authorization. So I'm not sure at all if that's what's happening in Italy and Switzerland, but that's a possibility for the Netherlands, compassionate use. Rocco, please.
No, it's not the same thing. We had, in Switzerland, we had compassionate use, but the company had to stop. And they are a very small company, not a lot of cash at hand, and so they stopped it, and this is why we resorted to this other legislation. It is possible, I mean, that's another thing that could be tried, to contact Clunevel and ask them to apply for compassionate use. I'm not saying that's not possible, but it is not the same thing that we have in Italy and Switzerland. It's not a compassionate use program.
Okay.
I've heard that it's not being allowed in the UK, is that right? It's not being approved in the UK.
I wouldn't know.
Well, it's not been approved in Europe yet, Victoria. We're waiting until January 2014 to hear from the European Medicines Agency if it's approved in Europe, and then after that, probably pretty quickly, you would hear about its approval in the UK. Rocco, Yasmin can correct me.
Yeah, again, I'm not sure if they might have applied for compassionate use, and that might have not been approved. I'm not sure about that. It is the drug is formally not approved in any country.
Right.
So, I want to repeat myself, but Italy, Switzerland have specific legislation that allow experimental drugs to be provisionally, so temporarily, approved for diseases which do not have any alternative treatment options. So in Switzerland and Italy, the authorities consider the EPP as not having any other alternative, efficacious alternative, and under that particular law, and with a yearly renewal of the approval, the drug is available. But if one day the EMA should decide that they are not going to formally approve and approve the drug, then even the programs in Switzerland and Italy will stop.
Yes, yes, yeah.
Okay. Why is Italy different to Europe?
Because they have a national legislation that allows that. That's why I'm saying I'm pretty convinced that, and Yasmin, correct me if I'm wrong, I'm pretty convinced that each European country must have similar legislation, like in Switzerland, like in Italy. Specifically, they have been developed for life-threatening diseases, these legislations, for cancer patients. But Italy and Switzerland managed to get CNS to be provisionally approved to those legislations.
That's exactly how I know it too. So Professor Minder, she also thinks that every national legislation should have somewhere hidden inside the same possibility. So go and check for it, or find your national porphyria specialists which are engaged enough to support and to look for those parts of the legislation. It should be there somewhere.
Okay, I wonder if we can go around now and just kind of have a final thought from each of our great presenters this evening. So, can we start with Yolanda?
Yeah.
Do you have anything else kind of you want to say to the webinar participants tonight, and about your story, and kind of what your take-home message would be?
First of all, I'd like to thank you and Rocco to organize everything what you have done. I would like to thank the other members for telling their stories, and wish them a lot of success. And hopefully Finesse will come, and we have to think that it's certainly, I'm hopeful, but I'm also very anxious to get it. And that's why sometimes I'm a little bit aggressive in how I act to the EMA or to other, how do you call it, health companies, because I believe we finally deserve that medicine who is there somewhere outside. And I'm sitting going in Holland to try about the natural law, what you are already told of, Rocco. So I take that with me at home, and I'm very thankful to that I have met all of you.
Listen, we really appreciate you taking part in this. I think you have every right to be aggressive and to send letters and to show pictures and to show how your life has changed. Keep that up. I think all of us can be advocates in our own way. And what I thought kind of shown about you right away from reading your story is how you are just really a great advocate. Next, maybe we can have Victoria kind of say goodbye and talk about what she thinks.
Yeah, again, I'm really grateful for being able to be a part of this, and it's a kind of a step forward in encouraging and supporting people who suffer the way that we do. And I just want to, anybody who hears this, and feels that they are alone with this condition, they're not. There are people who can help you and can support you. I spent many years alone, and now I'm no longer alone because somebody listened to me.
Yes, very nice, Victoria. Miriam, anything else to say as you kind of wait for some answers?
Actually, yes. I wanted to thank everyone. It was really incredible meeting other people with Porphyria. It's a unique experience for me. I haven't met anyone else before. And I'm lucky to have my own little public relations guru. I have a service animal for either Sanda, Jesus, future response dog. So I think a lot more people in my area know about Porphyria and they understand this than before, because everyone approaches the dog. It's been incredible meeting actual people who can share the experience. Thank you.
Ah, thanks, Miriam. Yasmin?
Yeah, thank you also to everybody, and this was really impressive stories and great to meet you all. And I hope I could add some understanding of the disease, and that it's really crucial to distinguish between the UV and the visible light, which is always mixed up even by the experts. Thanks.
Great. And, well, I'll leave the final word here to Rocco.
To me, thank you, Rob. Well, great responsibility. Thank you, Rob, from the bottom of our hearts. Thank you to EURORDIS to make this possible. Stay connected through the Rare Connect. It's really probably the best platform to remain connected internationally. Unfortunately, we couldn't get any simultaneous translation tonight, but Prayer Connect allows people from different countries and different languages to stay connected. So I'm making a plug here. And to your point, Yolanda, you don't have to excuse yourself for being aggressive. You're a patient with needs that few people listen to, so we have a right to be a little bit aggressive sometimes to get our message across. I think this helps. I think the EMEA has heard of us, has heard from my letter on behalf of many patients, but has heard from many other patients. So the more people knock on the EMEA's door, the better. There's nothing wrong with that, and because rare diseases, and particularly I'm talking about EPP tonight, of course, but rare diseases often are neglected. They are called neglected diseases, and we have every right to raise our voice because we do simply want to lead a normal life like everybody else. That's all we are asking for. EPP has the fortune that we have a promising product about to come on the market. I really, really, really hope that the EMEA will approve it because I know it works. I know it from other patients. The FDA, the American health authorities are going to look at it as well. I hope it's going to be approved there and then all over the world. And then the next battle will start for other porphyrias who will also need treatment, and so we'll have to keep our fight going. We'll have to do things like that. Again, I think the next one will be on acute porphyrias. And yes, thanks for everybody for their engagement, for participating, for investing their time in even their testimonials, and see you soon again somewhere.